I did about a decade in Stockton, also worked in Oakland, San Francisco Bay Area, as well as for the state. So saw a lot of trauma, a lot. Everything from accidents, shootings, stabbings, being shot at, being attacked, fighting people on drugs and PCP on a more regular basis than should be, for certain. Um, lost folks both in the line of duty that I've worked with, lost a lot of guys on and off duty. Just saw a lot of tragedy, a lot of death. I kind of was that black cloud as well. Like, something crazy was going to happen, it was going to be my call. I was going to be on it, and that carried across every agency I've worked with and my whole career. So that translated, I think, now looking back, I think, like I said in our initial interview, I was I'm just going to say, ignorant to PTSD, and very naive about it, especially in my earlier career. We knew little to nothing about it. It was barely being talked about in the earlier 2000s, even until probably the last 5 years. I would say that I knew almost nothing. And then started putting pieces together, realizing symptoms, but it really took me a long time. Now, knowing what I know, I probably had it at 21, probably a few years in. I saw more in my first couple of years of my career than most guys will, in their entire career. And there's new studies. I always felt that way. And then there's data that came out. There were folks that retired, or would have started per se in like the 70s and retired, let's say on an average 30-year career, about 2000. Now anybody coming in their first like 3 to 5 years across the board on average is going to see more than somebody would in a 35-year career 35 years ago, 30 years ago.
Is that across the board, or is that police, fire, paramedics?
That's all first responders, emergency services across the board. So anybody showing up to a 911 call, like somebody in 3 to 5 years now across the board. It's going to differ on the call volume in the areas, but across the board, they did a national study, and in 3 to 5 years now, people will see more than people did an entire career over decades, previous years ago. Just the increase in accidents, the increase in violence, I guess, studies. There's just a lot more going on, especially the mental health crisis. I would say there's a lot more suicides. So there's just a whole lot more trauma that these first responders are being exposed to at a significantly increased level than it used to be.
And when I talk to people about this, it's like, you talk about combat veterans, and like, oh, I totally get that. And I'm like, and a lot of times what's worst is our first responders, and they look at me kind of funny. And I'm like, well, who do you think sees all the car wrecks? Who do you think fishes the 4-year-old kids out of pools?